Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today I'm joined by Dr. Puri, and we're here today to talk about brain aneurysms. So my first question for you, doctor, is what is a brain aneurysm?
Brain aneurysm is a weakness in the vessel wall. As we get older, the vessel wall can sometimes weak and there is a bulge in the vessel wall, and over time as our blood goes into the vessel walls, it can cause the bulge to become bigger and bigger, almost like akin to a balloon, and then at some point that balloon can burst and cause bleeding inside the brain, which is a very fatal or a catastrophic event.
How common is a brain aneurysm?
It is an uncommon pathology, but almost 6 million people in the States have brain aneurysms. So 1 out of 18 of Americans have brain aneurysms. Now, how common is rupture? About 8 to 10 out of 100,000 people actually have a rupture of a brain aneurysm. That amounts to about 30,000 brain aneurysm ruptures in a year. And the bad part is about 40% of those patients might actually die from that brain aneurysms. The other part is of the people who survive, about 50 to 60% might be left with significant disabilities. Another point of fact is about 15% of the patients who have a brain bleed from an aneurysm might not even make it to the hospital. That's how fatal this disease is.
What are the symptoms for a brain aneurysm bleed?
If the brain aneurysm bleeds, the classic symptom is a severe headache. People describe it as that worst headache of their life. Even people with migraines who have dealt with headaches for their entire lives, they also feel this headache was the worst than any of their previous headaches. You can have loss of consciousness, you can have nausea, vomiting, you can have seizures, you can also have sometimes drooping of the eyelids from that. So any of these symptoms, it's very, very important to call 911 and come to the nearest hospital as soon as possible.
How do you treat them?
A brain aneurysm can be treated by 2 ways. One is a surgery where a surgeon will cut open a brain and go into the brain and put a clip there. Now, the newer innovative techniques, which are more minimal invasive, are going through either the groin artery or the artery of the arm and going up that all the way inside the arteries, going into the brain aneurysm and putting coils. Now, these are small platinum coils which can plug up the aneurysm and cause the aneurysm not to bleed again. And this is the more innovative, minimal invasive way of treating aneurysms now.
Can something be done before they bleed?
Absolutely. So we see a lot of patients where for some reason like headaches, trauma, migraines, people have CTs and MRIs of the head, and brain aneurysms are found on that. So that's a blessing in disguise. Sometimes people say, oh my God, we have a brain aneurysm. That's actually, I think, a blessing in disguise before something bad happens, like a bleed. Remember, we talked about how bad a bleed could be. So I see a lot of patients when they come in without the brain aneurysm having ruptured, and we can treat them. An elective treatment of the brain aneurysm is a whole different ballgame. The patients come in the morning, we treat them with anesthesia, and we can go in through the groin or the arm and treat them with coils and stents and special kind of stents. And 99% of the patients, they go home the next day walking, and I kid you not, people would not believe that they had brain surgery with a small hole less than 3 millimeters in the groin arm.
What are minimally invasive options for a brain aneurysm bleed?
The way we do it now in the last few years, because technology has moved so fast and forward that we have newer devices and techniques, we can actually go into the arteries of the brain with a small hole less than 3 millimeters in the groin or in the hand or arm, and we go in with small hollow tubes all the way into the brain and put some coils with or without help of stents and treat those brain aneurysms.
What technology does the neurointerventional radiology team offer?
We offer all cutting-edge technology in terms of the latest stents available, the latest special kind of tubes called flow-diverting tubes, which are available for these kind of patients. On top of it, UMass has been involved in multiple cutting-edge trials, which gives the patients in central Massachusetts the options to get this thing treated with the latest technology even before it comes to the general population and other hospitals. So the techniques or the technology which they will get at UMass is far ahead of the curve, which will be probably 5-6 years down the line available to other patients.
How do providers refer patients to the neurointerventional radiology team?
If you have a patient who has a brain aneurysm or any other pathology of the brain like an arteriovenous malformation or any fistula, they can call 508-334-8329. That's an outpatient consult. We also have an email called neurointerventional@umassmemorial.edu. referral.org, which is monitored, and we can get back to you. We offer our patients a consult within a week, and we will call back our providers within few hours if it's urgent.
And how does this technology help in treating brain aneurysms?
This is an angiography machine where we have a patient on the table and we go from the groin or the arm up under X-ray guidance and dye guidance, go up into the brain. This is actually a picture of a brain aneurysm being treated. This is how small it is. We are talking about millimeters. Our world is in millimeters, so this is a few millimeter aneurysm which we treated by a special technique called flow diversion, and this patient has been under our follow-up, and she's been seen and clearing, and she has no other aneurysms at all after this thing.